Welcome to Nursing Prep. Push yourself in nursing preparation with smart way. Practice this quiz on www.thestudyblog.com. Fundamentals of nursing. Which of the following principles of primary nursing has proven the most satisfying to the patient and nurse? Option A. Continuity of patient care promotes efficient, cost-effective nursing care. Option B. Autonomy and authority for planning are best delegated to a nurse who knows the patient well. Option C. Accountability is clearest when one nurse is responsible for the overall plan and its implementation. Option D. The holistic approach provides for a therapeutic relationship, continuity, and efficient nursing care. Right answer is Option D. The holistic approach provides for a therapeutic relationship, continuity, and efficient nursing care. Studies have shown that patients and nurses both respond well to primary nursing care units. Patients feel less anxious and isolated and more secure because they are allowed to participate in planning their own care. Nurses feel personal satisfaction, much of it related to positive feedback from the patients. They also seem to gain a greater sense of achievement and esprit de corps. If nurse administers an injection to a patient who refuses that injection, she has committed. Option A. Assault and battery. Option B. Negligence. Option C. Malpractice. Option D. None of the above. Right answer is Option A. Assault and battery. Assault is the unjustifiable attempt or threat to touch or injure another person. Battery is the unlawful touching of another person or the carrying out of threatened physical harm. Thus, any act that a nurse performs on the patient against his will is considered assault and battery. If patient asks the nurse her opinion about a particular physician and the nurse replies that the physician is incompetent, the nurse could be held liable for Option A. Slander. Option B. Libel. Option C. Assault. Option D. Respondent superior. Right answer is Option A. Slander. Oral communication that injures an individual's reputation is considered slander. Written communication that does the same is considered libel. A registered nurse reaches to answer the telephone on a busy pediatric unit, momentarily turning away from a 3-month-old infant she has been weighing. The infant falls off the scale, suffering a skull fracture. The nurse could be charged with Option A. Defamation. Option B. Assault. Option C. Battery. Option D. Malpractice. Right answer is Option D. Malpractice. Malpractice is defined as injurious or unprofessional actions that harm another. It involves professional misconduct, such as omission or commission of an act that a reasonable and prudent nurse would or would not do. In this example, the standard of care was breached. A 3-month-old infant should never be left unattended on a scale. Which of the following is an example of nursing malpractice? Option A. The nurse administers penicillin to a patient with a documented history of allergy to the drug. The patient experiences an allergic reaction and has cerebral damage resulting from anoxia. Option B. The nurse applies a hot water bottle or a heating pad to the abdomen of a patient with abdominal cramping. Option C. The nurse assists a patient out of bed with the bed locked in position. The patient slips and fractures his right humerus. Option D. The nurse administers the wrong medication to a patient and the patient vomits. This information is documented and reported to the physician and the nursing supervisor. Right answer is Option A. The nurse administers penicillin to a patient with a documented history of allergy to the drug. The patient experiences an allergic reaction and has cerebral damage resulting from anoxia. The 3 elements necessary to establish a nursing malpractice are nursing error, administering penicillin to a patient with a documented allergy to the drug, injury, cerebral damage, and proximal cause, administering the penicillin caused the cerebral damage. Which of the following signs and symptoms would the nurse expect to find when assessing an Asian patient for postoperative pain following abdominal surgery? Option A. Decreased blood pressure and heart rate and shallow respirations. Option B. Quiet crying. Option C. Immobility, diaphoresis, and avoidance of deep breathing or coughing. Option D. Changing position every 2 hours. Right answer is option C. Immobility, diaphoresis, and avoidance of deep breathing or coughing. An Asian patient is likely to hide his pain. Consequently, the nurse must observe for objective signs. In an abdominal surgery patient, these might include immobility, diaphoresis, and avoidance of deep breathing or coughing, as well as increased heart rate, shallow respirations, stemming from pain upon moving the diaphragm and respiratory muscles, and guarding or rigidity of the abdominal wall. Such a patient is unlikely to display motion, such as crying. A patient is admitted to the hospital with complaints of nausea, vomiting, diarrhea, and severe abdominal pain. Which of the following would immediately alert the nurse that the patient has bleeding from the GI tract? Option A. Complete blood count. Option B. Guaiac test. Option C. Vital signs. Option D. Abdominal girth. Right answer is option B. Guaiac test. To assess for GI tract bleeding when frank blood is absent, the nurse has 2 options. She can test for occult blood in vomitus, if present, or in stool, through Guaiac, hemoccult test. A complete blood count does not provide immediate results and does not always immediately reflect blood loss. Changes in vital signs may be caused by factors other than blood loss. Abdominal girth is unrelated to blood loss. The correct sequence for assessing the abdomen is option A. Tympanic percussion, measurement of abdominal girth, and inspection. Option B. Assessment for distension, tenderness, and discoloration around the umbilicus. Option C. Percussions, palpation, and auscultation. Option D. Auscultation, percussion, and palpation. Right answer is option D. Auscultation, percussion, and palpation. Because percussion and palpation can affect bowel motility and thus bowel sounds, they should follow auscultation in abdominal assessment. Tympanic percussion, measurement of abdominal girth, and inspection are methods of assessing the abdomen. Assessing for distension, tenderness, and discoloration around the umbilicus can indicate various bowel-related conditions, such as cholecystitis, appendicitis, and peritonitis. High-pitched gurgles head over the right lower quadrant are option A. A sign of increased bowel motility. Option B. A sign of decreased bowel motility. Option C. Normal bowel sounds. Option D. A sign of abdominal cramping. Right answer is option C. Normal bowel sounds. High-pitched gurgles head over the right lower quadrant are normal bowel sounds. Hyperactive sounds indicate increased bowel motility. 2 or 3 sounds per minute indicate decreased bowel motility. Abdominal cramping with hyperactive, high-pitched tinkling bowel sounds can indicate a bowel obstruction. A patient about to undergo abdominal inspection is best placed in which of the following positions? Option A. Prone. Option B. Trendelenburg. Option C. Supine. Option D. Side-lying. Right answer is option C. Supine. The supine position, also called the dorsal position, in which the patient lies on his back with his face upward, allows for easy access to the abdomen. In the prone position, the patient lies on his abdomen with his face turned to the side. In the Trendelenburg position, The head of the bed is tilted downward to 30 to 40 degrees so that the upper body is lower than the legs. In the lateral position, the patient lies on his side. Thanks for watching. You can also practice this quiz on www.thestudyblog.com, link in description box. If you have any doubt, ask in comment section, and you like our video, then do like, comment, share. Subscribe our channel for regular updates.